episode 160, Strength and Conditioning, Kinetic Therapies. I'm your host, Dr. Justin Trosclair, and today we hear Dr. Jackson Tisdell's perspective. During 2017 and 18 Podcast Awards nominated host and best-selling author on Amazon, as we get a behind-the-curtain look at all types of doctor and guest specialties. Let's hear a doctor's perspective. Thanks for tuning in. It's September. The NFL has started this weekend. College football has started. And social distancing is still in effect. Regardless of your politics, I know it's about to get crazy over the next 60 days. So good luck with all those political ads. But Dr. Jackson here, he doesn't have to worry about that because he's all the way from Australia. He's a podiatrist. And we're going to talk about strength and conditioning and how that looks for a podiatrist. Top 3 conditions that he treats, for instance, like plantar fasciitis and forefoot pain. Misconceptions about orthotics, for instance. And he's partnered up with someone else for this educational thing called Kinetic Therapies. As you can imagine, it's going to deal with conditioning and strengthening and lectures and things like that so that you can actually take the information and implement it into your clinic. It's not just for athletes. This could just be for someone who's maybe overweight, has a bad foot and knee, and can't walk across the house to go to the bathroom. What do you do? So he's a young guy, but he's had a lot of experience before podiatry school and during, and he's had some amazing mentors in his niche. So he's, I think, beyond the years that he actually has. So that's pretty cool. I want to let you know, a couple of months now, I actually finally put the acupuncture, if you want to call it acupressure, book on Amazon. It is selling nicely, but not enough reviews. So if you bought it, leave a review. And this is something, I mentioned it a good bit, but the reason is if you're a doctor and these patients need something that they want to do at their house, self-care type of thing, this is an option for them to try in between your visits. Okay, you can go to adoctorsperspective.net/ACP Amazon. ACP Amazon. Lastly, one thing I've noticed from some guests lately, and this is a few months at this point, are one sheets. It's pretty much just a synopsis of your credentials, your accomplishments, your past speaking engagement, as well as topics that you feel like you are an expert at so that a local business, organization, another podcast would read it and say, oh, I want this person on my show, on my stage. I'm doing those, graphic design, putting it together for you so you don't have to. It's actually on Fiverr. You just search my name or direct message me, and I can just bypass Fiverr and talk to you directly. So all the show notes and the transcript can be found at adoctorsperspective.net/160. Let's go hashtag behind the curtain. Live from Germany and Melbourne, Australia, today on the show, we've got a podiatrist. And he is super into strength and conditioning. He's got several different jobs because that's how they roll. And currently, they're on lockdown, but hey, they're essential. So that's a pretty awesome thing. Please welcome to the show, Jackson Tisdell.
Hey, thanks for having me, Justin. Really excited.
Yeah, pre-show, we we're just chatting about current situation. Everyone I know is talking about second wave is going to hit probably around election for us. I'm in Germany, but still affiliate with America. It's good to see that you are able to socialize, that you're able to actually provide a service, and that Australia respects what you do. And if I'm not mistaken, though, you're not called doctors there, correct?
No. Well, technically we are doctors. We're allowed to use the term doctors, but we generally don't.
Okay. I mixed you up with the United Kingdom. They're like, no, be careful, Justin. Don't say those words. Okay.
Yeah. It is.
Don't get me in trouble.
It is a topic of debate, but we could talk about that all day, so we won't go into it.
No problem. Well, as a chiropractor, there's a lot of people that say we should not be called doctors.
Yeah.
But hey, well, back to you. All right, podiatry. There's so many things that you could do, and you chose that. So what's kind of your backstory? And then you can bridge it, if you'd like, into your specialty and where you are now.
Yeah, for sure. So I got into podiatry. My first exposure to podiatry was when I saw a podiatrist as a youngster, which is really, really a common story that you hear from podiatrists. They saw a podiatrist when they were younger. And I had some foot and leg issues coming through as a junior athlete, and that got me interested in the whole sports and podiatry and physio, that side of things. But I didn't really know what I wanted to do until it was literally I was lying in bed one night and I had a light bulb moment. It just clicked in my head. I was like, I'm going to do podiatry. And then the next day I got into podiatry. It was really cool. So why did I decide to choose it? It's just, I guess based on my own history of injuries and being frustrated with not being able to play my sport and that sort of thing, and how that really affected me. And I developed a bit of a passion and an interest in rehabilitating myself and getting myself back stronger to playing sport. So, and I really got interested in it and was doing like my own sort of research and studying and that sort of stuff without being a podiatrist. I was like, I'm just gonna study this properly. I'm gonna make this a career. So my area of specialty within podiatry is in strength and conditioning and rehabilitations, prescribing exercises to get people stronger and more mobile. And because that's where I see the real value in what we do, is making people a bit more proactive in their approach to their healthcare and being strong and resilient, and not so much us providing them with treatment, but us actually educating them and building their strength so that they don't need ongoing treatment. That's where I see the future of healthcare based around strength and exercise.
So I had a series a while back, I guess last year, Pure Podiatry. We covered lots of different niches, if you will.
Yes.
So are you still doing like reconstructive ankle sprains and Achilles tears? And do you find yourself doing surgeries? Or are you kind of doing more of like the physical therapy style of podiatry?
Yeah, definitely more just physical therapy and biomechanics and orthotics. Podiatrists in Australia don't do major surgeries. We do minor surgeries. Yeah, any reconstructive stuff goes to the orthopedic surgeons. So I think in other countries, like in the States, for example, they're all podiatrists there are surgeons, but no, not in Australia. So yeah, I'm very much just focused on the rehabilitation and biomechanics, orthotics, strength in the gym, that sort of stuff.
Okay.
For lower limb problems.
Did you find it difficult to find a career in doing that if you were trying to get a job instead of starting your own place? Like, are they like, we kind of need you to do all the other podiatry stuff as well? Or how's that play out?
Yeah, it's a good question. I was pretty lucky when I first graduated as a podiatrist. I got a job in a clinic that only did sports podiatry. So they only did rehabilitation and biomechanics. So I didn't have to do anything else like cutting toenails or anything, which was really, really, really good. So that was a really good start to my career. But it is quite rare to find that. But as you go on through your career generally in Australia, you do start to sort of niche down and find your specialty sort of area. Once you get a bit more experience and exposure, you get to figure out what you like, and then you can develop your own sort of interest area.
I'm going to ask you more about your strength and conditioning.
Yes.
Do you ever wonder, boy, in 20 years, I'm not going to have that skill anymore that I went to school for? Is that concerning at all?
What do you mean by that exactly? So I'm going to forget general podiatry stuff?
Yeah, like if you're like, man, I'm really not into this anymore. Just if something happened, you're like, I need to switch gears. I'm getting old, or maybe you had an injury and you're like, I really can't get as physical as I should be. Obviously, you could hire other people, but
yep.
You ever wondered like, oh man, I'm not going to have that skill anymore?
Not really. I think if I keep pretty fit and active myself, and I guess the coaching side of things, you don't have to necessarily get super involved in the session. You can just do a quick demonstration and then coach the athletes through it. It depends on the athlete as to how much you actually have to demonstrate to them. Depends on what level they're at. But no, don't worry about that. I'm pretty fit and active and healthy. So and I enjoy getting in the gym myself and running and that sort of thing. So I think I'll be okay.
Yeah, you look fit. He looks fit, everybody who can't see him. So what do you prescribe to? Is there any special technique or seminars or anything like that you've taken to say this is my foundation for my strength and conditioning, and then from there we just modify based on the person's specific needs? Yeah,
for sure. So I've been a coach outside of podiatry for a couple of years now.
What's a coach mean in Australia?
So like a strength and conditioning coach.
Okay.
Out on the track, speed and agility type stuff as well, and in the gyms and stuff. I've done that for a couple of years. I was working underneath a really, really good coach in Sydney, Renelle Hobson, and she taught me a lot as far as the basics of athletic development and speed and agility and injury prevention. So I did have some practical experience in that regard. But then I did do a more formal course with the Australian Strength and Conditioning Association. So I was actually officially qualified as a strength and conditioning coach, which was good. And then I've done a few other sort of online courses and stuff like that to learn a few skills. But I think most of the knowledge you develop as a coach is practical, and that the art of coaching, it comes from being sort of involved in coaching yourself. You can't learn that from any books or anything like that. So practical experience is what I draw upon, and I'm still learning as I go and getting some more experience. Once these lockdowns are over, I'll be doing a lot more coaching, so it's good.
Are you recording videos of the most common things you would recommend and just having them go to YouTube or whatever to watch that, since it's kind of more difficult for them? Or what are you doing?
At the moment, we've got a bit more time on our hands to do some more social media content and developing videos and that sort of thing. I do have a YouTube channel, but it's only relatively new. I am posting some more videos and just information on social media for people. And we do with our clients as well. We do offer a online coaching service and online podiatry as well. So just online consultations through telehealth, which has been okay. We can, certainly if people can't come to see us, we can do that as well through the lockdowns, which has been helpful. I am trying to produce a lot more videos and social media and marketing and that sort of thing at the moment, which keeps me busy, which is good.
Yeah, I'm sitting here thinking, man, I've got downtime sometimes at work, and I'm like, I should just record these videos of the most common exercises I give all day and just kind of categorize them and just say, okay, here's this link, go to YouTube. I'm not going to make money off of these videos. There's not going to be that many views, but that way they feel like there's something that they can watch after they leave the office. It's like, wait, what did he say to do again? How did he do it? It just seems to be helpful.
I'll just add to that. What I find most helpful is if they're coming into the clinic or the gym and you're showing them through the exercise, and then they have to go off on their own and do it. I actually like to film them doing it. So I get their phone and I film them doing it. So then they can just watch themselves back doing it. And that's probably more meaningful to them rather than sending them a YouTube link, for example. So give that a try. It's quick and easy.
Yeah, that's pretty great. Yeah. With the experience that you have now, do you wonder if being a podiatrist was necessary and you could have just been a strength and conditioning coach?
I definitely think podiatry was necessary. And I've definitely found sort of a niche area within podiatry. So that's really cool. So having that podiatry degree, university degree behind me, and because podiatry it's always going to be in demand sort of thing. Like it's a medical service. So if I'm working within a medical field, and then if I can bring strength and conditioning within the medical field, then that's gonna make it more enjoyable for me. But definitely having that degree behind me and being a podiatrist is really beneficial. No regrets there at all, and definitely necessary. Okay. Definitely necessary to get me to where I want to be and where I am today. So.
Do you find that you have to look beyond the foot and ankle for a lot of the conditioning? Like, yes, your foot hurts, but it goes into your calf, it goes to your knee. Now you got a hip involved. I mean, you just have to look at the whole picture, or what?
Yeah, absolutely. That's one of my biggest sort of philosophies with what I do, especially if someone has single-sided foot pain. So if they've only got pain on their right foot and not their left, then there's a reason behind that. So you have to look further up the chain towards the hip and the core muscles, and that's what I like to do, and I address that. We want to always address the cause of the issue, not just the issue itself. We want to get to the bottom of it so that it doesn't come back long term. So I definitely have a big emphasis on hip and core muscle strength and stability when it comes to looking at the foot and ankle. So definitely, which is something that podiatrists are starting to hopefully learn a little bit more about and start to incorporate into their practice, which gets better long-term results if you look more holistically at the patient.
What's your top 3, I guess, foot injuries that you have to rehabilitate?
I'd say plantar fasciitis and just heel pain in general is the biggest one. Obviously, a lot of bunion pain and first MTPJ, forefoot pain. I'll just collectively say forefoot pain. So we get a lot of, plantar plate tears, Morton's neuromas, first MTPJ pain, bunions, that sort of thing. And then Probably bone stress injuries, so either medial tibial stress syndrome or shin splints, and stress fractures of the foot. They're common ones that I see as well.
Anything simple for a chiropractor or a physical therapist? I mean, should we just run to some kind of foot orthotic, or just, because we always treat a little bit of feet, you know what I mean?
Yeah.
Anything that we should go to and we say, hey, you know what, this is out of my scope now. A little plantar fasciitis has just started. Typically we can take care of that a little bit. But at what point should we say to ourselves, this is past me, let's pass them on to a podiatrist?
I think that's a really good question, and it's something that I've previously thought a little bit stronger on. Like I've been like, no, chiropractors shouldn't treat feet, but that's obviously that's just not true and not realistic. I think you'll just know yourself if you're starting to go outside of your clinical scope. If you feel like you're trying to come up with answers and you're not sure about them yourself, then that's when you need to refer on. Or if there's something maybe perhaps more biomechanically related specific to the foot and ankle that hasn't been covered in your chiro training, and I think that's when you should refer on. But I really think that you'll just know, and if you find yourself trying to sort of make something up to answer a question, or if you're trying to just give something to them to sell them something to make money, like that's not right. You need to understand when it's outside of your scope. And it's the same with us, right? If, say for example, podiatrists, we're essentially lower limb specialists, so we know the entire lower limb, but the amount of detail we know about the knee, for example, isn't as much as a physical therapist or a physiotherapist. So if someone has a knee issue that I think is related to their foot or their mechanics, then I'll happily treat that knee issue by looking at their foot and their hips within my scope of practice. But if someone has like a more chronic knee injury or something like that, where I'm going to need to go deep into what's happening at the knee, then I'll just refer them to a physiotherapist. I won't tackle that. So I think with the more experience you get as well, you tend to understand when you're going outside of your own clinical boundaries.
I like that. If I saw a bunch of bunions on the foot, I'd be like, no, that's not for me, man. I need to. I don't know what to do with that. Get out of here. Here's a question I really haven't asked recently. I guess that we got so caught up in everybody else's great answers that just skipped this question. But for you, I think I actually want to ask it. What are some of the most common misconceptions that either other professionals have or that your patients are having with podiatry and with your particular niche?
Yeah, there's a lot, hey. So obviously the big one for the podiatry profession in general is that people think that we only cut toenails or we only look after hard skin and callus and corns, and that's what
diabetes.
Yeah, diabetes. That's generally what people think the podiatry profession is. When that forms the core and the basis of what we do, and that's sort of the stereotype. But we do a hell of a lot more, and there's so many different things we can help people with. Not only elderly clients who need nail and skin care, but we work with athletes as well. So with their foot mechanics and their performance and their injury management. So that's probably the biggest misconception from the general public and possibly from other professionals as well. Other things such as pain equals injury. So if you're in pain, it means that you're causing damage or that you're injured, and people don't understand the complexity of pain science and pain, which is a really big topic in itself, which we could talk all day about. But yeah, pain is not always the enemy. So I like to explain to people that they are allowed to push through their pain a little bit with some of the exercises and things like that, and they don't have to rest. Say for example, with back pain, for example, you wouldn't tell someone to just lie in bed all day, which has been the traditional sort of model of getting people to rest their injuries, when we know that movement and exercise is really important, especially for the Achilles tendon, with Achilles tendonitis and that sort of thing. It responds really well to load and strengthening and not rest. Rest is not going to be the answer. So that's a really big one. Another really big one that's probably going to be relevant to your listeners is around orthotics. So what orthotics actually do and who needs orthotics. That's a really complex, highly debatable topic. The conception that orthotics, realign the skeleton and they make you function normally, or they make your foot function neutral and that sort of thing. That's not true at all. What orthotics do is they actually just manage loads and they reduce tissue stress. So they're used as a tool in the rehab process to help maybe perhaps speed things up a little bit or make life a bit more comfortable for you, but they don't actually change the way you're aligned or anything like that. They're just a tool, and not everyone needs them. And a lot of people who have orthotics, when we give them orthotics, they can actually go out of their orthotics once they've built up enough strength in their own body and they're over their injury, then they don't need those orthotics ever again. So a few common misconceptions there.
I tell you, I haven't seen so many orthotics in my life than I have in this country. It's just like, oh, you got a short leg. Let's put a lift in for you.
Yeah, yeah.
Have they addressed anything else? And it's not from a podiatrist. It's like, man. So half the time, you get them balanced out and everything, and they don't need them anymore. It's like, guys, did you dig deep at all sometimes? It's crazy.
Yeah.
But that's the difference, depending on what kind of doctor you go to.
Yeah. It's a frustrating one, but it's, yeah.
Do you have any apps that you use to like record athletes in like a slow-mo running or the way they're loading or unloading on their stressing their feet when they're doing certain exercises to kind of capture it and analyze or anything like that?
None in particular I can think of off the top of my head. Like I do film gait analysis and running gait and that sort of thing, but I can usually just, once it's on my phone, I can just like slow it down and have a look at it on just the iPhone. I don't have any particular software that I use.
Sorry, tech guys.
Yeah.
Not much.
I just use my camera on my phone and film it and watch it back and slow it down if I need to. There is a couple of things that I've used before, but I find it's a bit nitpicky. And
Okay, are we back?
Yeah, you can hear me?
Yeah.
Good.
Okay, so let's switch gears a little bit. What are some of the things that you're doing as far as marketing? And if you're not really into that role in your offices, we can talk about something else. But is there anything that you're doing or your company's doing that works really well?
So we're really emphasizing, and I'm really emphasizing myself for my personal stuff, is social media, just producing more. I think social media these days is producing content on social media is the price of sort of relevance, and it's the new way of marketing in society, because that's what everyone's entrenched in in their day-to-day lives. It's just Facebook, Instagram, LinkedIn, TikTok now, all that sort of stuff.
Yeah, indeed.
Trying to do more of that and really emphasizing that. And I think more is better because so like quality and quantity. So with the more quantity you produce, that will then tell you what quality is, because you'll get a feel of what people engage with and what they enjoy more, and then you can start to just do more of that. Quality and quantity, more, and consistency with your social media content. Try to be engaging with it and trying to provide value. So give out useful information to people, not trying to get people to come and see you in your clinic. Like don't say things like, oh, come and book an appointment and that sort of stuff, because people will just back away from that. If you, rather than doing that, just provide value to them that's useful to them, then that positions you in their mind as an expert. So then when they do actually have a problem that they need help with, they'll just automatically think of you and book in with you. So it's not about trying to tell them to book in with you, because that sounds desperate. You need to just give them useful information and provide them with value, and that establishes yourself as an expert. So and just more is better. More.
It is interesting how many people are afraid to, if I put these exercises or these special things that I've learned over the years on the internet, they're not going to come see me. There's going to be no reason. They can just do everything that I showed them on the phone, on the computer. And it's like, no, that's actually the opposite. Like, they're going to trust you, appreciate what you gave. And if they can't figure it out or they hurt themselves, now they already know, like, hey, can I see this person? Oh, yeah, we're in the same town. Perfect.
Yes.
Exactly what you said. But it's counterintuitive. You're supposed to keep everything secret, No,
there's no secrets, especially amongst practitioners as well. Like it's good to share information and help each other, because it's just good karma, right? It's just good to help helping each other. Yeah.
Do you have to do anything with your staff? Are you in charge of training them or disciplining them or hiring or anything like that?
No. So I'm an employee. I don't have any team members underneath me at the moment, but hopefully in the future. I do enjoy mentoring and teaching. I have done like some online like Zoom sessions with some students and new graduates, helping them to navigate through their own sort of journey as a podiatrist. So that's been really beneficial. So, but not within the clinic, no.
And it's funny, that's the next question is for either new docs or they're changing their niche or students, any big advice that you would just say, hey, this is what I would tell anybody right now?
There's so much. I've just done a video series on LinkedIn of new grad tips, and I'm up to the 30th one now. So I want to keep.
Oh wow.
I want to keep going until I get to like 100, hopefully. I'm running out of ideas though. So, but I think the biggest sort of advice would be just to have self-awareness and not compare yourself to others, and don't compare yourself to others, and always just compete with yourself. Have self-awareness of where you're at, and that success is very subjective. So what one person thinks they need to be doing is not what you should be doing. You should just worry about you, and that sort of thing. All that sort of wishy-washy self-awareness sort of motivational stuff.
Headspace.
Yeah.
Well, I'll put a note in the transcript or your show notes for your LinkedIn profile, and that way they can either friend request you or just kind of browse through those videos, because 30 is a lot of videos. That's a lot of tips already.
Yeah.
If anybody can think of something that either he just send him an email, send him a message, maybe that can help him out to try to get to 100. That is definitely a milestone. Man, you can do a lot with that when that's done too.
Definitely. Yeah. Good. It's good stuff. I enjoy helping students and new graduates because I was only a student not long ago. Like I've only been graduated this is my 3rd year now. So heading towards my 4th year. So yeah, I can relate to them and, understand where they're coming from with their problems. Are
you hooked up with any schools or professional or semi-professional teams or anything like that?
Not at this point in time. I used to work with a lot of sporting clubs, but at the moment I've just moved to a new clinic and we're in lockdown and stuff. So it's a bit difficult. But no, I'm doing a webinar for Western Sydney University on mentorship. That's coming up at the end of this month. That'll be exciting. So,
how'd you get your feet in the door with all that mentorship and counseling young kids? I say young kids, you know what I mean? The younger students to do this. What was that passion for?
It started because I had a student come in to see me in the clinic, like to do some clinical observation and practice they were asking me some questions and I was answering their questions, and it was all really simple, basic stuff. And they were like, oh, no one's ever told me that before. Like they didn't learn it at university. So I was like, oh, really? So it just started from there. I started to take on more students, and then I started to post my thoughts and opinions and advice online on LinkedIn, and then it just grew from there. So and then just doing it. I just started mentoring people and then posted about it and got myself out there, and then that's what's led to the opportunities I've had. So yeah, nothing in particular. Just start. Just if you want to do something, just start doing it.
Yeah, that's pretty good. No, 3 years still being able to do that. That's pretty cool, because some people really want to do that and then they struggle. So that's great.
For sure.
All right. So Dr. Tisdell, what is this kinetic therapy? I saw it a little bit on LinkedIn. It's intriguing, but I didn't dive deep enough into it. I was like, hey, let's interview the guy and just ask. So what is that?
Yeah, Kinetic Therapies is Talisha Reeve and I. She's my mentor. We're developing courses and webinars and resources and that sort of thing for other podiatrists to learn from. So all about exercise prescription and exercise therapies and movement and strength and conditioning for lower limb conditions. So it's an educational company, and we run courses and webinars and things like that. So definitely check us out on Facebook and Instagram and that sort of stuff. And then we have an online course at the moment that is available on Ultimate Podiatrist website. So yeah, go check that out. And yeah, it's educational, sort of that sort of thing. I really enjoy that as well.
What would they get out of that? Kind of some of the things that you're doing on a daily basis that some podiatrists might be like, I don't know anything about it, but that is definitely an area I want to develop myself and get some of those clients. So this is one way that they can take some courses and learn this. Is that the point?
Yeah. And the main aim of it is for them to get practical information out. So not just giving them a bunch of, research and PowerPoint slides and that sort of thing. We're trying to develop their understanding and their actual skill set and ability to apply exercise therapies and strength and conditioning in clinical practice. So it's very much focused on practical learning and being able to interpret information and develop treatment plans yourself. So we're not just spoon feeding a whole list of exercises and that sort of thing. We're developing the students' education and knowledge on how to apply these things themselves.
Okay. Like we were talking about earlier, the Achilles, you need to load it. Don't let it rest.
Yeah.
Here's the theory, convert it into practical.
Yeah.
And maybe there'll be like here's a 5-step process, but like we teach you a process and then you can actually convert that into all these other injuries as well. It's not just for an Achilles or whatever. It's the concept behind it that becomes practical and you can just use all the time.
Yeah, definitely, and it's never black and white either. Nothing we do in strength and conditioning is black and white. There's always grey areas and highly individual. You should never give athletes or your patients the same program. You should always find out what they're capable of and build around them. So we're very much about that, which is an art form. It's a skill in itself. So our courses aim to develop that ability of the practitioner to be able to do that.
Would you say it's more for like the beginner athlete or all the way up into, the professional footy player?
No, it's for anyone really. Podiatrists see a wide range of clients from elderly, even really old, 90-year-old people that have musculoskeletal conditions. They can benefit from strength training and exercise.
Oh yeah, I kind of niched down just to athletes, but actually this is anybody who's like, I can't walk to the bathroom anymore. Oh, well, we should probably work at that as a goal.
Yes, 100%. Yeah. So the course is aimed for practitioners to be able to apply these skills to whoever they work with.
Yeah, my head really got tuned into like sports and athletes and things like that, and I kind of completely forgot. Like, bunions. That could be just the 40-year-old who's been wearing high heels for the last 20 years to work and now has problems. And what do you do with that?
Yes.
Yeah.
Yeah, 100%. I enjoy seeing clients of all sort of demographics and all age groups. I particularly enjoy, obviously, similar age clients to me, like, 25, sporty, playing footy and that sort of thing, because I can relate to them. I do enjoy working with all clientele, all ages. So.
Were you good at footy?
Not good enough to make professional or anything like that, but I really enjoy it and still always strive for my best. So still playing these days. It's good.
Good. Yeah, it's not. I've seen the videos. I played a little bit. It is not for the weak of heart.
Is that the Australian football? You've seen Australian football?
Yeah, in Denver, America actually has a whole league.
Yeah.
And in Denver, they were the top dogs for, I don't know, I think they've won 5 or 6 gold championships or whatever you want to call it.
Yeah.
And I kick myself. I've said this story a long time ago. And so
yeah,
I was playing and I was just starting my chiropractic clinic. And during one of the practices, they had went somewhere for a game and they came back and one guy like dislocated his elbow and somebody hurt his knee. I started thinking about this and I was like, I'm enjoying practice, but I just don't know if I should take it to that next level and play in a bunch of games. Because if I hurt myself in my first year in practice, that could be really a bad situation, financially and everything.
Yeah.
And so I kind of took a step back and they ended up winning the first place in the tournament. And I could have been like, yeah, championship athlete right here. But instead, I just played for a while. Yeah, so I'm sure our league is not as intense as you guys. We would never make it to your professional level, but there's people out there.
Oh, that's interesting.
All right. Maybe let's pretend that the coronavirus is not around. And what would you do normally for a home work-life balance? And then you can bridge that also into if you have a significant other, what have you learned so far to keep those relationships healthy?
Work-life balance is I think it's a very self-awareness thing again. So if you really enjoy what you do, then you don't really consider, it's that old cliche, like you don't really consider your work as work. Like you'd be happy to continue studying and I enjoy continuing to study and produce content and do what I do outside of work. But I don't see that as affecting my work-life balance because I really enjoy it. So it's almost like a hobby to me as well. But in order to maintain relationships and things like that, like with my partner, we have a couple of scheduled like nights or days per week where we don't do anything but hang out together. So we have like a Wednesday night date night where we go out and nothing else matters on that night, and we have like one day on the weekend where it's dedicated to just hanging out and go for a walk or whatever you want to do on that day. I think scheduling, so having a good time blocked sort of dedicated time is the most important thing to maintaining a good work-life balance. And then I think knowing when to switch off, so and for how long to switch off for. So like I'm very good at going all in on everything I do. So when I go all in on my work, like I'm very focused and I enjoy doing it. And I could work like that for a whole week, but want to have a break or have time off. I go all in on that break and time off. Like I fully, completely switch off and just fully relax and have a few beers and watch footy or a movie or something. Like just being able to go all in, I think is the most important thing.
Okay. Yeah, and sometimes you just can't do that every day. Like the other person needs something from us, and it's like, But I had a plan. Okay, all right, I'm going to have to pause on this for a little while, take care of the partner's needs, and then maybe that night I can get back into it, at least for me personally. And, it's like with the podcast, it takes a lot of time, but it's not like I get a ton of sponsorships or anything like that to where I'm on an official deadline. So sometimes I'm like, all right, I'll just have to hang up my podcast hat today or just all these little projects that I have and just spend time with the wife and the child, which is what I try to do anyway, up until she goes to bed. So yeah, different days, different strokes. So it's fun.
Yeah. Just block the time out, I think, and just stick to that.
Yeah.
At a minimum, at least have a minimum blocked out time slot.
I've talked about this for the minisodes, and this is more for the audience than yourself. But there's a technique called Pomodoro. Have you heard of that?
Never.
It's kind of like a 25 minutes. You focus on some task, and then you take like a 5-minute break, and then you do that 4 times in a row, and then you can have like a nice 30-minute to 30-minute break, kind of, and you can like switch tasks each time.
Yep.
Because a lot of us, I'm sure yourself, you could, man, you got so many sticks in the fire or fire in the sticks, whatever it's called. And you're like, man, I got a lot to do. If I just focus on this one thing, then nothing really gets done because it just takes a little bit of time. So it's a way to cover lots of topics in one evening or in one day. So you always are making progress. And maybe in 2 weeks, the project's finished versus 2 months down the road, you still haven't got to it yet because something else popped up,
Yeah, for sure. No, I think having a schedule really helps with that. So I've dedicated like days to the different sort of projects I'm working on and different clinics and different businesses, and that on those days I'm just all in on that and don't worry about the other ones for that day. And then
I love it.
Just having it planned. You can also get like apps on your phone that like shut off your phone and they like plant a tree for you. Have you seen that? It's called Forest. If you download an app called Forest, you set a timer, so 2 hours, 3 hours, 1 hour, whatever, and then you're not allowed to touch your phone for that period of time, and you can see on your phone that the tree is growing, and then if it gets to the end of it without you touching your phone and without closing the app, then they actually plant a tree for you somewhere in the world.
Oh, that's a nice thing. That's better than just shutting off your social media for an hour and locking your phone and being frustrated.
Yeah, so you're being productive by not playing around on your phone, but you're also helping the environment, I guess.
That should help a whole bunch of these recyclable people, all these green earth people. That should be very good for them. Great, called Forest. We'll have to look into that. That's cool.
Yeah, for sure.
Lastly, any favorite books, blogs, or podcasts or YouTube channels for that matter that you find yourself listening to, watching, and think other people should tune in?
Yeah, I really prefer podcasts as opposed to books. So there's a few that I listen to because I drive an hour to work, so an hour there and back. So plenty of time for podcasts. So I've got, I'm a big fan of Gary Vaynerchuk, Gary V Audio Experience. Also Tyson Franklin's Podiatry Legends podcast.
Oh, it's a good one.
Yeah, it's a podcast on just podiatry and all different podiatrists doing interviews or conversations similar to this one.
He was on my show, by the way. I was on his show and he was on my show, so it's great.
Oh, really?
Tyson Franklin, guys.
Were you on the It's No Secret with Dr. T? Is that the one? Yeah.
Yeah, correct.
Cool. So I'm working my way through that one now as well. I've only just discovered that one, so I'll listen to your episode next.
He always says his podiatry book. No, he says his business book is better than his podiatry book, but his podiatry book sells more because it's such a niche.
Yes.
I was like, very interesting there, Dr. Tyson.
Yeah, definitely. There's one book I've read, The Greatness Guide. It's by Robin Sharma. I've got it in here in front of me. It's I think he's from the US, and it's called The Greatness Guide. It's 101 lessons for making what's good at work and in life even better. Sort of like my new grad tips. I'm trying to develop 100 of them, similar to this guy's book, because this book was really, really helpful to me. My mentor, Daniel, gave it to me as a gift, and it's been really good.
Well, that should definitely help you find some topics to talk about.
Yeah.
Repackage some, Yeah, that's great. Oh, and how can people get in touch with you? Any websites, emails, etc.?
Yeah, so my email address is jacksontisdell@gmail.com. Also, just LinkedIn. Message me on LinkedIn. That's my biggest sort of platform that I'm most active on. Happy for people to add me on Facebook and stuff like that as well. No dramas.
Very good. Thank you so much for being on the show and giving us some information, some things to think about. I really do hope that the Kinetic Therapies takes off for you, as well as the mentoring and everything. So really excited to see where you go. And it's fun. It's a weird thing, but seeing some of the past guests and where they go over the last year or two, it's been really awesome. So I look forward to following you and wish you the best of luck.
Yeah, thanks very much. I really enjoyed it. Hope I'll have to come back on the show at a later date. It was really good.
Another great interview has ended. While you're on your phone, click that review button. Write up a nice review for me. 5 stars if you could. As everyone says in the industry, it'll help other people to find us when we have enough rankings. Not to mention, I'll mention you and your review on an upcoming episode. If you follow me at all on Instagram, you know you only get one link. So I use a Linktree. And so it's a doctorsperspective.net/links with an S. And that's going to give you everything you need to know. The top episodes of 2017 and 2018, the Podiatry series, Dentist, Acupuncture series, Holiday 2017, Financial series, how to write a review, how to support the show like buying a cup of coffee, getting swag like t-shirts, the Today's Choices Tomorrow's Health book, that's the blueprints for better health, exercise, picking food correctly, and financial. And then, of course, bundle packs, which can get you the No Needle Acupuncture book for 40 common conditions, including the electric acupuncture pin at a great deal. The resources page has some of the products that I like. It's affiliate style, so if you buy something from them, I get a piece of that. Just like on the show notes pages, if you buy a book from clicking that link, I get a small piece of that as well. So I really appreciate that. Things like Screencast-O-Matic, Pure VPN, Missing Letter, JLab speakers, ProLone Edge or Hawk grips. Once again, if you do need any coaching on how to improve some of your blood work, drop weight, and the ProLone diet, fast mimicking diet 5-day plan, let me know. As well as if you just need some coaching, whether it's health, whether it's marketing, whether you need some practice growth, etc. Reach out. Facebook, Justin Trosclair, MCC. Of course, at a doctorsperspective.net on the top right, you got all the social media icons that you can imagine. Click your favorite and reach out. Thank you so much for tuning in. Please tell a friend, pass it along. You can go to .net/listen. It's just that easy. It'll open up right in your app. And don't forget, I appreciate you. Listen, critically think, and integrate. See you on the mini-sodes on Thursdays and Saturdays. Hope you're enjoying those. I'm definitely having fun summarizing these podcasts in less than 10 minutes for you. You get the nuggets without having to waste your time. Have a great week.
A doctor's perspective. Learn stories of success. Avoid struggles they've met. Doctors of all kinds come together to help you shine. So sit back, take it in, and integrate.